Come again? Parang hindi nagtutugma yung data. 8.5 on
Positive for MRSA po, Doc.
4 out of 100.
Out of 47 is Orius.
4 out of 47, the one who gives positive. So saan ang galing itong una? Una is those who give positive with Staph aureus. Okay.
It's Orius only po.
Okay. So out of... Pero mataas pa rin. Oo. Okay.
You have cited several studies concerning this. How does your result compare with what you have found with the other institutions? Because this is kind of scary.
Two foreign studies po, they found out that it is almost same as our data, like 8.5, like 2 point something %. But here in Philippines, there is only one study that has been done, which is in PGH nga po. And they have found out that there is 0% of, there is no MRSA carriage among the pediatric workers in PGH. And so we did this study at Fatima, and we found out that there were four health workers who are positive for MRSA.
You know, I'm saying it's kind of scary because considering the situation in PGH compared to Fatima, they come up with 0 and we come up with a number. I can't figure it out.
Doc, the one that was conducted in PGH was only in the pediatric unit, and only 26 people or only 26 participants joined the study. So compared to what we have done here in Fatima, I think there's a much larger difference in the population.
What is the total populations of nurses and doctors at Fatima Medical Center? Total population?
133, Doc.
So 123, the combinations of residents and
nurses.
Nurses. So 137, you got 10.
101, Doc.
101. So nag-miss na. So parang almost 70% ang nakuha yung sample, right?
Yes, Doc.
So out of 70%, you got 8.5, which is positive for MRSA.
Yes, Doc.
Now, did you try to check which among the department have the highest? Hindi, kasi it's very crucial. Kasi for example, if you can identify which among the department, kasi baka doon may problema rin.
In our study, Doc, those who were tested positive for MRSA were the staff nurses.
Coming from what department?
One from ER, Doc, and then 3 in the ward.
Which ward?
I stand corrected, Doc. There are 2 in the ER and then 2 in the ward. But as for the ward, we cannot identify it yet, Doc, because these staff are rotating while we were doing our study.
So, did you happen to limit the age range of because in your target population, you only mentioned that 77 staff nurses and 24 resident physicians were included in the study. But did you particularly define an age range?
No, Doc. The basis for us choosing our participants are based on the risk factors that we were able to identify from those who are MRSA carriers based on our studies that we have presented already.
Because remember that the immune response of the patient also depends on the age, so you should have defined the age that you included the nurses and the resident physicians.
It's only carry age, they are not yet infected with the microorganism. So we did not consider the age or the health status of the health workers, nurses and
So yun,
residents.
better na if next time there should be an age range, no? Kasi para well-defined yung population mo. Kasi like for this, in this case, I don't know if you included someone who's more than 40 or 50 years old. So mas maganda kung defined. So at least we know na if we compare this result with a different hospital na defined din yung population nila, masasabi natin comparable. And another thing is, you have a lot of figures. So remember again, the number of objectives equals the number of tables or figures. So actually your figures 4 up to 6, pwede siyang i-combine in one figure. No? So yun. And also again, the Biblio use the standard way of citation.
Just to clarify, whenever we speak with nurses, it's include the staff nurse, the head nurse, the supervisor, or only the staff nurses?
Staff nurse only daw.
Okay. Okay. Next question. Since this is the results of your study, what will be your recommendation to the hospital there?
Ideally, regular screening was suggested in different studies, but also this depends on the capability of the institution if they could do regular screening. But if not, then those health workers who are exposed or who are in direct care of these patients who are MRSA positive should be screened, and also hindi po.
So, nag-positive. Anong gagawin natin sa APA? Sunugin na lang sila ng buhay?
It has been suggested that mupirocin nasal ointment must be administered for 5 days to these MRSA carriers.
Thank you very much to our panel.